Hi, Assalamualaikum. My name is Amir Aiman bin Amir Rizal. My student number 2022909839. I am from HM2421A2. Today, I would like to present about informative speech. For informative speech, I choose the dangers of human immunodeficiency virus HIV. I choose this topic because the cases of HIV in Malaysia is increased. It happened because the Malaysian lack of exposure of HIV. I hope from my informative speech it can make the cases slowly down. Before I finish my presentation, I will show you the statistic of HIV in Malaysia. Okay, first introduction. HIV or human immunodeficiency virus is the virus that causes AIDS. The HIV infection will gradually destroy the body's immune system, making it vulnerable to a whole range of infection and cancer. Okay, there are two main points to prevent the HIV, which are practice a healthy lifestyle and get the treatment for prevention. Okay, for the first point for practice a healthy lifestyle is avoid alcohol and illicit drugs. It is because recent studies found that the use of intoxicating alcohol can well be delusion illicit drugs, example cocaine and shabu, that are closely linked to free sex habits. So, if we avoid the alcohol and illegal drugs, we can we cannot get HIV. Next is the using a condom during the sexual intercourse. Although many men understand that using condom can reduce sexual intercourse, believe that it can effectively reduce the risk of HIV infection. Okay. After that, stay away from unnatural sex. The example of unnatural sex are incest, group sex, gay, lesbians, bisexual intercourse. Okay. Lastly, is avoid the service that do not practice hygiene. It is because for the service can increase the risk of HIV. For example, the service are shaving, tattooing, and piercing service center. For the first point for get the right treatment for prevention is take medication as recommended. It is because taking medication according to your doctor advice is important to ensuring that your treatment regimen is successful. Next is perform HIV screening regularly. It is because from screening regularly, it can ensure that your viral load, condition or infection rate from time to time is at a controlled level. Next, the third point is discuss the method of giving birth to a baby. The mother who is positive HIV should talk to your gynecologist and the doctor know how to give birth to a baby safe and can protect your baby from infection. Lastly, is know the limit of baby care. It is because HIV positive mother or father should take care of some things in case the baby care such as avoid chewing food to feed to them. The statistic shows the changes of landscape of HIV in Malaysia between 1990, 2010 and 2018. At 1990, we can see that the intravenous drug use is 61%, which is the highest than the others, which is 34, and followed by heterosexual, which is 5%. Meanwhile, sexual intercourse between men and infection in worm is 0%. For 2010, we can see that the intravenous drug use is 48%, followed by heterosexual is 40%. After that, the sexual intercourse between men is 8%, and followed by the others, which is 3%. Lastly, infection in between womb only 1%. For 1018, sexual intercourse between men is highest than others, which is 57%, and followed by heterosexual is 37%. For intravenous drug use and others is average, which is 3%. Lastly, infection in womb is 0%. From this graph, we can see that the intercourse between men is increased every year. For conclusion, we must get a more knowledge about HIV because if we have knowledge, we can prevent it. We also must follow the doctor advice because the doctor know what the best treatment to us. Lastly, take care of your own behavior and practice before you regret. Recommendation. For the first recommendation is more awareness to public. It is because from awareness, we can attract public to get more knowledge about the dangers of HIV. The second is educate religious education. From that, it will make people afraid to do a bad things. Lastly, collaboration between government and NGOs can make the cases decrease. That's all from me. Thank you.